Hello and namaste. Let's focus on today's clinical questions. A questions like that 50-year-old man diagnosis with chronic idiopathic thrombocytopenia purpura 6 months ago present with recurrent oral mucosal bleeding. Okay. Despite treatment with corticosteroid called prednisolone. And on the CVC examinations, his platelet count is 45,000 per microliter. He is not a candidate for splenectomy. Which of the following is the most appropriate next line therapy? Can you guess a true option of these questions? Okay. Then correct treatment is iltrombobac. As can you see that in a answer. Okay, then what is iltrombobac? Iltrombobac is a thrombopoietin receptor agonist, and this iltrombobac stimulates the platelet productions in the bone marrow. But how? This iltrombobac stimulates the platelet production in the bone marrow by increasing the proliferations and differentiation of the megakaryotes. Okay, and if you focus on the chronic ITP, that is chronic immune thrombocytopenia purpura, then it is a autoimmune disease. Means there is production of the antibodies, but question is against which the products antibodies, but against which? Okay, then in case of chronic ITP, the production of antibodies against the glycoproteins like that glycoprotein 1b and 10 or glycoprotein 2b and 3a. So there is destruction of platelet in case of this patient occur. Okay, and this chronic ITP, it's a type 2 hypersensitive reactions. It is more common in female as compared to male, as we can see that. Okay, and the patient present with clinical presentation like oral mucosal bleeding, as mentioned questions we can early discuss. Okay, and gastrointestinal and mucosal bleeding, and have a menstrual bleeding and wet purpura, also retinal hemorrhage. Okay, simple. And what investigations can you perform to diagnosis of the thrombocytopenia purpura? Okay, the investigation like that thrombocytopenia purpura means there is decreased platelet count. In peripheral blood smears, we see that reduced platelet count and large immature platelet greater than 6%. Can you see? On bone marrow examination, there is increase in megakaryotes. Okay, and what treatment can you apply in patient with the chronic ITP? The treatment is simply removal of the spleen. Even there is no splenomegaly in patient with ITP. But in case of relapse or contraindication of removal of spleen called splenectomy, like mentioned question, there is a contraindication of the splenectomy. Then in this case we use the what drugs? Iltrombobac, which is the thrombopoietin receptor agonist. Okay, and immunosuppressive therapy we can also be used. Okay, what immunosuppressive therapy use? Like that rituximab, we can use rituximab in patient with chronic ITP. Okay, then also question that why in case of this patient, that is present in chronic ITP, we will not use intravenous immunoglobulin, as also mentioned in the question B option. Why? Because it is used in a patient acute ITP, but this patient is chronic ITP. Okay, because this patient have chronic ITP, not acute ITP. That's why we not prefer option. What option? Intravenous immunoglobulin. It is true, but only in acute. I need temporarily increase the platelet count in patient and by inhibiting the destruction of platelet. And also there is a question and that why C option is correct, platelet transfusions, because as there is formation of the autoantibody, we know that Okay, and this antibodies again destroy this platelet. That's why it's not preferred. Simple na yaar. And high dose prednisolone. Patient has already on the prednisolone, so that it is not effective treatment in patient with chronic ITP. Thank you.